Restless leg syndrome can occur at any age, but its frequency increases as a person gets older. Unfortunately, most doctors still don't fully understand what this disease is, often make not quite, and sometimes completely incorrect diagnoses, and sometimes even prescribe treatment that can exacerbate the restless leg syndrome. In this video, we'll try to figure out what restless leg syndrome is, how to diagnose it, and how to treat it. Watch this video to the end, and I'll give you a few simple tips on how to sometimes cope with restless leg syndrome yourself. What is restless leg syndrome? It seems like such a funny diagnosis at first glance, restless legs. But I want to say that sometimes patients come to me with suicidal thoughts because of this. It's sometimes such a severe disease that a person can't sleep normally. He can't live normally. I'll tell you some extreme symptoms of this disease. A person at rest, predominantly in the second half of the day or before sleep, experiences indescribable but extremely unpleasant sensations in the legs, forcing a person to move the legs. A person cannot formulate what it is exactly. During the day, worms are freezing under the skin, electricity is passing. Some charges there, that is, in general, once again, it is an indescribable situation, but extremely unpleasant. So, they move their legs, the sensation passes, but literally after 1-2 minutes or even a few seconds, it happens again, and they need to move their legs. The problem arises. A person lies down to sleep. They want to fall asleep, relax, and periodically have waves of this extremely unpleasant sensation, forcing to move the legs, and a person cannot actually fall asleep. Look at the video. You see this woman who walks. This is actually a study that we conduct in our sleep medicine center. She has a mass of sensors hanging on her, but she can't even lie in bed because she has this unpleasant sensation constantly interfering with her urge to calm down, lie down, and fall asleep. And as you see further in the continuation of this video, that a person can walk like this for hours and hours. I have patients who come and tell me, "Doctor, I have those step trackers on my wrist, and I walked 12 miles at night around the house, on the street, in the district, just because I can't fall asleep. I have this constant sensation in my legs." And you see now, this woman is still suffering and can't fall asleep in any way. If you also have symptoms of restless leg syndrome, like this video, the second, so to speak, side of this problem is that even if a person got tired and fell asleep in the middle of the night, their legs periodically continue to twitch. You see this on the next video. This is a slightly accelerated video, well, because it happens every 20 seconds or so, and we don't want this video to be too long. So the legs twitch and reflexively wake up the brain, and the legs can twitch 1-2 times a minute. It's like someone knocks on the brain and says, "Wake up." And even if a person fell asleep, his sleep is still ineffective. He can't get a good night's sleep, and only towards morning when this situation subsides, a person says, "Okay, I can finally get an hour or two of sleep." In general, this can lead to the heaviest forms of insomnia. A huge problem is that people sometimes can't formulate these complaints. A person comes saying, Doctor, something is wrong with my legs." Well, if it's a doctor who was not taught somnology at the university, and unfortunately we are still not taught somnology at the university, the doctor does not understand what restless leg syndrome is. Although it is also a neurological disease, which prevents a person from sleeping or a person's legs twitch at night, the doctor may not quite understand this. What is the doctor thinking? Let's examine some vessels, and let's examine the joints. They examine, and there is nothing. We will then talk about the diagnosis. It is actually based not on some examinations. It is a clinical assessment of the situation, okay? So they examined everything, and it did not reveal anything, and the person still says they can't sleep. But what thought arises in the doctor's mind? I'll send this patient to a psychiatrist. Well, I'll just tell a specific story about one old lady. Her first symptoms appeared in year 1944 when she was still a teenager, and we diagnosed her in 2008 when she was already in her 80s. She told us so many things. They had removed her veins, gave her some injections in the joints, she went to some radon baths, and she was in psych ward. So about psychiatry. A person comes to a psychiatrist and tells the doctor, "I have worms crawling under my skin, and they prevent me from sleeping." What does the psychiatrist think in this situation? Well, of course, these are tactile hallucinations. Let me prescribe some neuroleptics that help with them. Yes, neuroleptics can help with real tactile hallucinations, but neuroleptics, like a class of drugs, have what is called a class-dependent side effect. They interfere with the regulation of dopamine. And actually speaking, as we will say later, this is essentially a problem with the dopamine system, the restless leg syndrome. And they exacerbate restless leg syndrome. So this old lady was prescribed neuroleptics. She said that I got even worse. Likely, the disease is advancing. The dosage requires an increase. They increased her dose, it got even worse. And only when she quit on her own she got better. All the psychiatrists were surprised. Generally, it all resulted in nothing. And so, imagine, for decades, this situation dragged on for this old lady. This is not a problem with the legs themselves. It's a problem with the disruption of dopamine regulation in the brain, or dopamine receptors, the transport of iron into the brain. In fact, it's a disruption of such biochemical processes in the brain that regulate motor activity. And if this problem arises, specific symptoms appear in a person. Once again, firstly, there are uncomfortable sensations in the legs, which constantly force a person to move them. The second symptom, or criterion, is a situation that worsens in the second half of the day and in the first half of the night and lasts until morning. The thing is that in the evening we start producing melatonin, and melatonin is an antagonist of dopamine. That is, our dopamine system suffers, and the restless leg syndrome begins. So, if melatonin additionally suppresses dopamine, the restless leg syndrome worsens when we want to sleep, because melatonin is produced. And the next sign is that movement alleviates the situation. That is, if a person moved, the situation normalized. And this constant movement activity, the person can't even sit still. Well, additional symptoms are actually insomnia and periodic limb movements in sleep. That is, we can actually diagnose based on simply asking the patient and understanding that such a disease exists. There's a good saying that it's easy to diagnose this disease if you simply understand that it exists. And if you basically know nothing about it, you'll think it's some kind of hallucinations, maybe even schizophrenia, that the patient is making something up, or it's some problems with veins, with nerve conductivity, or something like that. That is, you can simply lead the diagnostic search and treatment search completely astray, so to speak, not make the correct diagnosis, and sometimes prescribe treatment that ultimately makes the person's symptoms even worse. What else exacerbates restless leg syndrome? It's your basic stress. Well, the thing is, if the excitability of the nervous system increases, it also provokes restless leg syndrome. And, in principle, dealing with stress allows to alleviate this condition. I recently wrote a book called Stress and Insomnia: How to Break Out of the Vicious Circle, 12 Steps to Healthy Sleep. It describes a step-by-step instruction on how to apply some techniques independently at home to alleviate stress, to reduce insomnia. And if you feel more relaxed, then the likelihood that restless leg syndrome will bother you decreases. In the description to this video, you will find a link to this book. Be sure to read it. So the first thing is a thorough inquiry. The next thing that needs to be done is to actually check the iron and ferritin levels in the blood. Remember I said that the disruption of iron transport to the brain and the disruption of dopamine synthesis are related to this. So the iron level needs to be checked, the ferritin level. Ferritin is a protein that indicates iron reserves in the body, and the iron may not decrease significantly yet, but ferritin is already decreasing. And even more so, a situation that requires attention. We have ferritin norms. If you look at them, there are around 20/30 to 150 and 200. You may say, 20 is a norm too then? Not at all. This is far from the norm, especially in a patient with restless leg syndrome. That is, all modern clinical recommendations say that you need to keep the ferritin level above 75 in this situation. Of course, yes, you can conduct some research, exclude problems with the spine, with some kind of neuropathy, with polyneuropathy, with diabetic neuropathy. That is, those or some other reasons. But if you have ruled out other causes and you know the symptoms, then yes, this is a very likely diagnosis. But there is also a very specific treatment. There are stimulators of dopamine receptors. So back to the old lady. If you remember, I said that symptoms began in year 44, and she was treated in 2008. The next night after diagnosis, we prescribed her pramipexole. It's a drug, a dopamine receptor stimulator, or Mirapex. Again, I would emphasize that in any situation, you should consult with a doctor. because even pramipexole has its own side effects and contraindications, but it's a super effective remedy for restless leg syndrome. We gave her the drug for the night, and she slept all night soundly for the first time. Look at the video. You see, this is not just a picture. This is just a person sleeping peacefully. When I came to this old lady in the morning, she saw me, poor thing, burst into tears saying, "Oh son, I lost a big part of my life." That just says how much, first of all, the disease itself spoils a person's life, and on the other hand, how there are effective treatment methods that help this person. And sometimes we even feel like we are, well, not God, of course, but angel saviors. When we give this treatment to a person, and for the first time in many years, they actually sleep. Yes, of course, the drug itself has certain difficulties, even the probability of developing dependence. Let me emphasize once again, all this should be decided by a qualified doctor, because there are different drugs, different combinations of them, and all this needs to be done under control, accordingly, of a doctor. But let me emphasize once again, firstly, this is a serious illness. If there are doctors watching this, you should also read about this disease. Secondly, if you have these symptoms, then most likely you have what is called restless leg syndrome, and you should probably turn to a qualified neurologist or somnologist to deal with this. And once again, there are effective methods of treating this disease. Well, I also promised that I would say what a person can do at home, perhaps even before going to the doctor. The first thing we've already discussed with you is that you need to do iron and ferritin tests. And if these parameters are low, then you can figure out what to do with your regular doctor, how to replace iron to raise the level of iron and the level of ferritin above 75. You can even tell your general practitioner, you know, I most likely have restless leg syndrome. I need to increase my iron. Because not even all doctors know about this. What else specifically exacerbates restless leg syndrome? Ordinary caffeine. And we all consume a lot of tea, even coffee sometimes, right before sleep. In this situation, all caffeine-containing products should be excluded. A person often does not associate the fact that he drinks 3 to 4 cups of coffee or tea with the fact that his restless leg syndrome gets worse before sleep. But by removing caffeine, you will see that after a week or two, if caffeine again aggravates restless leg syndrome, you will see a significant relief of the symptoms. And another small life hack. If your symptoms are mild and you do not yet require the prescription of any drugs, try to move your legs a bit before going to bed, because the longer you stay motionless, the more likely this syndrome, which develops when you're resting, will start to develop. Therefore, it would be good to take a little walk, maybe a small stretch before sleep. That is, engage in some kind of physical activity, even if it's just walking, and then you will fall asleep faster. If you have already fallen asleep, then it's likely sleep process would not disturbed. At least in mild cases, simple caffeine reduction and physical activity can help a lot. This is also a possible so-called distraction therapy. A person says, I put on some ointments on, and now it burns, and this serves as distraction. And really, it somehow switches the brain of a person in general. It's very interesting. Sometimes, when a person plays cards, computer games, or plays chess, this feeling disappears. That is, when a person actively concentrates on something. But here's another mechanism. When a person, for example, gets some kind of pleasure, this is also tied to the activation of the dopamine system. It is activated, and accordingly, less symptoms of restless leg syndrome arise. That is, if you are attentively engaged in some activity, it also distracts you from restless leg syndrome. For example, if a person flies in a plane or drives in a car, then they should simply engage in something. Then it's less likely that this feeling will arise. Subscribe to my YouTube channel. Click on the bell so as not to miss my new interesting videos on my remarkable YouTube channel.